Welcome, everyone, to another episode of the Friends of NPACE Podcast. And this is always off the cuff, so we're going to have a great conversation today. I know the audience is really forgiving when I mess up or when I get excited and talk over the guests. So I'm going to try not to do that. I'm thrilled today to bring you this podcast with continuing education, due in part to a generous grant from Merck, where we're going to talk about vaccines, which is a topic near and dear to my heart. I'm also thrilled to be talking to an expert in the field, and I'm always just so excited to talk to her and have fangirl moments, which I try not to have that much, but she is a brilliant mind on vaccinations, and that's nurse practitioner Dr. Wendy Wright. A little bit about Wendy. She got her doctorate in nursing practice in 2019 from the University of Alabama, Tuscaloosa. She is a 1992 graduate of the adult primary care nurse practitioner program at Simmons College in Boston, Massachusetts. And then she went back and got a family nurse practitioner postmaster's in 1995. She is the owner of a nurse practitioner owned and operated clinic within New Hampshire. And in addition, she's owner of Partners in Healthcare Education, which is a medical education company. And she's the chief clinical officer of Duet Technologies, who we are thrilled to partner with on many things. In 2005, she was inducted as a fellow into the American Academy of Nurse Practitioners. In October 2014, a fellow of the American Academy of Nursing, and in March 2017, a fellow into the National Academies of Practice, which is a very big deal. She presents nationally on different audiences, and she's been a speaker at over 1,000 conferences in 48 states. But I want her to tell us in just a minute how she started this vaccine journey, because she actually does some state and national vaccine advising. So welcome, Dr. Wright.
Well, I have fangirl moments with you as well. So I'm so excited to be here. So I have loved and been passionate about vaccines for my entire career. I really believe that part of it started when I was a little girl, and my mom was so pro-vaccine because she lived through the time when there was polio, and she saw the consequences of a lot of these vaccine preventable diseases. And I remember so candidly her marching into our physician assistant office, family physician, but we saw PA back then. And she literally was saying to him, "Give my daughter the smallpox vaccine." And he said, "Ma'am, we don't have it available any longer." She's like, "Well, my oldest daughter got it." But she was so passionate about it. So I think, it's something I've always lived in. And as nurse practitioners, you know, Terri, our whole focus is, what can we prevent, right? Can we prevent a disease and not have to diagnose it and not have to treat it? So I think that's part of it. And then about 20 years ago, I was asked to be the nurse practitioner representative on the board on behalf of the New Hampshire Nurses Association to the New Hampshire Immunization Advisory Board. And I did that for 15 years, where we helped to make decisions about what vaccines were going to be made available in the state. And that led to a lot of different work. But in New Hampshire, we are one of a handful of what we call universal access states to vaccines, which means I don't have to pay for any childhood vaccines for any child 0 to 19 years of age as a nurse practitioner owner. Those are provided to me from the state. And then there's a fund that's set up by the insurers in our state who give this money to an organization who then pays the state, pays the CDC for vaccines. What we found is it gives providers and patients choices about what vaccines that they want. And there should not be a child in the state of New Hampshire who goes without a vaccine because they can't afford it. It is all provided as part of this fund. So that's kind of how it all started. And I did my doctoral work on vaccine communication. And all this great vaccines available, but how the heck do we get them into the arms and into the legs of our kids and our adult patients? And that is a real strategy these days. It's harder, I think, than it's ever been. I don't know if you're seeing that, but people are questioning science today, and they're questioning us. And is this something I really need to have? So.
Yes, I find that all the time. And one of the biggest concerns I hear about in like the dispelling the myths is the side effects. Well, I know someone, I in fact have a family member who is an educated healthcare clinician for years. And all of a sudden, post-COVID is like, I know people who've had strokes and heart attacks. Now, granted, this person is near 60 years old. So that age group, but it's all post-COVID vaccines. So talk a little bit about the myths of, especially in adults, side effects and safety of vaccines that maybe we can dispel as primary care providers.
I just saw a study that came out showing that the number one concern people have with vaccines is side effects, and that is the concerning fact that precludes a lot of people from getting the vaccines. But as nurse practitioners, I take it really seriously in that you only hear positive side effects or things that happen. No one goes home and posts on social media, I didn't have a reaction at all to that flu shot. The only people that post are people who have had something happen, or, and then everyone has a story and they want to tell their neighbors, well, my arm was so sore. I mean, just because the rooster crows that morning doesn't mean that the sun came up, or vice versa, right? Things can happen. You can have an MI when you're 70 years of age, and it's not necessarily linked to something bad. So one of the things that, or at least a vaccine that is, one of the things I try to really focus with my patients on is, yes, your arm will be sore. Yes, you may ache all over. Here are some strategies to combat that side effect, but just know that serious adverse events are very rare with the majority of vaccines. And so, but it takes time to have those conversations. And in busy practices, what we've seen over the last 4 years since the COVID pandemic is providers are tired and they're fatigued, and they don't want to bring it up because they don't want to have to argue with people. And if I can share you a very interesting story, yesterday, I had a new patient come into the clinic, and on the sheet that was filled out, it said, I will consent to no vaccines. Please put that in my chart. So I said to her, I saw your I will consent to no vaccines, but that's just not the way it works. You can't put that on your registration sheet. But just so you know, in this clinic, before you get a vaccine, you have to sign a consent. So if you're not given any paperwork, we're not going to be injecting you. And she goes, well, I've heard about offices that inject people with things that they don't consent to. And I said, well, I'm not sure that that's necessarily true, but if it is, it's not going to be here. And so she said, well, you don't believe in vaccines, do you? I said, I most certainly believe in vaccines. And I said, and you asking me that is like asking me if I'm a Republican or a Democrat. You and I are probably going to have to agree to disagree today, but I have a job to do. And my job is to tell you that this is what I believe in based on everything I know from 32 years of reading science. If you choose not to do it, it is your body. I can't make you do it. And so one of the things I've learned about folks like that is, I'm going to tell you my spiel. You choose to do with it what you will. Those are folks you probably are never going to move. You're never going to move them. But I'm not going to die trying per se. I'm going to focus on what I call the movable middle. And this was part of my research in my doctoral program. There's this group of people that are in the movable middle, and they're actually like, I think the statistics are somewhere around 40 to 60% of people, including adults, are in that middle. And they come in and they may not think I'm going to get this vaccine, but if the provider, the nurse practitioner, physician associate, physician makes a strong recommendation that this is something that you should have, they will walk out with it. So that's the population that I focus on, is the group in the middle, because the other group walks in and says, I'm due for my flu shot, give it to me. Give me whatever you think I need. And there are still people like that. But it's the middle that just feel like I have to ask. I just need to know that this is okay to do. And then if we make that recommendation, they really will take that vaccine.
Yeah, I love that. You make me smile because all of my kids are now out of the house, and I was that mom who took them for everything. Like, we were even in a family practice office that didn't give HPV vaccine. And I said, and it was before we were giving it routinely to boys. And I said, all of them, get HPV vaccine. And now they're all gone. And my daughter texted me the other day. She goes, I just went to campus and got my flu shot. And I'm like, yes, I raised these people. They will be the people who come.
Absolutely. And, I have a son. I still have to text him. I think I'll text him until the day I die. But have you gone yet, Dawn, to get your shot? But he knows that it is fundamentally good practice. And as I said to him with COVID, during COVID, I understand you don't necessarily want this vaccine, but your dad has some health issues. And so I think personalizing those messages to my patients are helpful. You're not just doing this for you. You're doing this for your mom that you live with who has cancer. And if you're vaccinated, you are less likely to bring it home. And if you do get the disease, you're less likely to have a protracted period of shedding of the virus, and you're less likely to be hospitalized or die from it. So I think personalizing a message, that's another point I hope our listeners hear, is that studies have shown that if we can just personalize, find something in their medical history. And these days I'm using age because the studies with COVID have really shaped out that age, being 50, 60, 70, every decade you age, your risk of being hospitalized or dying from COVID is substantially high. I think I just saw a number, something like this, that if you're 85 and older, you are 330 times more likely to be hospitalized from COVID or die from it compared to someone under the age of 50. So, age is really shaping out as a significant risk factor, as it has with influenza, as it is with RSV and a lot of these respiratory vaccine viruses.
Yeah, I think that's a really good point. And since the population is aging, so much of my population is over that threshold that it's just really important, or they're taking care of parents in that threshold.
Absolutely.
So how do you respond to, I hear this sometimes, I always get sick when I get the flu vaccine, or I've never had a flu vaccine and I've never gotten the flu.
Yes, I love that strategy so much, or I love those comments. So number one, when I inject an antigen in your body mounts an immune response. And so what I encourage you to do anytime you get any vaccine, just as you do when you get a cold, is to go home and make sure you're resting, make sure you're drinking your vitamin C and you're eating healthy, but the key is sleep. And what I also would say to you is that this is an inactivated vaccine. And what that means is it's very different than it was 50 years ago. You can't get the flu from the flu vaccine. It is physically impossible. However, you are mounting an immune response. Someone said to me yesterday, every time I get the COVID vaccine, the glands in my neck are swollen. I said, that's a good thing. That's your body mounting an immune response. And the fact that it's doing that, that's a good thing. And she's like, okay, I just needed to know that that's normal. And so being able to turn it around and put a positive spin and say, and if you don't feel good, get rest, but take some acetaminophen or take some ibuprofen. I remember when I got my first COVID vaccine, I had rigors. Like this was December 8th of 2020, right? Well, is that when we got our first one? I think so. And I laid there shaking and shivering because I didn't want to interfere with its efficacy, because we've heard over the years, don't take anything.
Right.
You don't interfere. Well, I don't care if it interferes these days. The minute I get a COVID vaccine, I always take acetaminophen, and I do it for every 4 to 6 hours for 24 hours. I'm not going to suffer. Why suffer? When I can take something to try to mitigate some of the side effects. But at the end of the day, you can't get these illnesses. The only live virus vaccines we're really even using are MMR, varicella, and intranasal flu, which a lot of people aren't using, and rota. Most of the vaccines are inactivated and can't cause the disease. And then the other person who says, I've never had the flu, I say to them, then you're probably at risk, actually. And the older, because you probably have no antibodies. So giving you this vaccine could be really helpful in giving you antibodies. And so I recommend you get it because you don't want the flu. The flu isn't sniffles. The flu is bad COVID. And people can get really sick from that. So sometimes it works. Sometimes it doesn't. But I did my job and I tried. And I always say, we're here if you decide you want to get the vaccine.
No, and I think just planting the seed and talking about that is always good. You never know who'll come back and say, remember when we talked about, I think this time. I've had patients do that. I thought about what you said.
Absolutely.
Okay.
It's planting that seed. And the next year they're a year older. And so what I say to them is, I see you're not getting the flu, but now you're in this 50-year age where your risk, if you do get the flu, it's not just flu, you're going to increase your risk of cardiac events, increase your risk of strokes. So it's not just flu, it's an inflammatory disorder. And so I need you to think about that. Planting the seed, but having a trusting relationship with a provider really goes a long way to that person taking those vaccines. That's why when primary care doesn't exist for people, they are much less likely to be vaccinated.
Yeah, that's a whole, we should do a whole episode on the lack of primary care, but we'll get to that. One of the things in social media that I'm seeing a lot is this uptick in homeopathic, your immune system is great, even among some of our healthcare colleagues with degrees. So I do get from patients, I have my own immune system. It should be good enough to fight off infection. I need to give my immune system the chance to work as it was supposed to. So I'm not getting any vaccines. How do we address that?
I say, you know what, we are lucky because we're lucky that we have an immune system, but some of our immune systems are better than others. If our immune system was perfect, no one in the world would get cancer. No one in the world would get pneumonia. No one in the world would get any of these infections. What we are doing is we are giving your system an antigen so your immune system can respond and protect you from the most severe forms of these diseases, because no immune system is perfect.
Okay, I think that's really good. Are there I've never gotten flu, or I get flu from the flu vaccine or the side effects or immune system. Well, what kind of other myths do you hear?
Oh, geez. Well, for years, particularly in kids, we heard about the autism myth, right? We heard about that. I hear, well, I get regular chiropractic manipulations and my chiropractic that's going to help to fight off infection. And I say it's an adjunct, just like during COVID, masks were an adjunct to the vaccine, which was an adjunct to isolation. None of these are perfect. So I think it's great if that's what you want to do, but chiropractic has not been shown to universally block viruses. If it were, none of us would ever get any viruses out there if it was effective and working for everyone. So I want to support you in what you do, and I want you to continue to do chiropractic care. My brother-in-law is a chiropractor, so if that it's not that I'm averse to it, but I don't believe it cures all of the ills, and I don't believe it cures all of the infections and cancer, because if it did, we'd have no diseases in America.
Yeah, I battled the autism questions for a long time in pediatrics. And so the chiropractic care is an interesting too, because I have had patients say that. So those are excellent points.
And Terri, I think that those are the folks that are probably at the extreme end, right, of the anti-vax kind of movement. You and I have talked about this before, but maybe some of our listeners heard that there are something like, is it 8 states this year? It's either 8 or 18, so don't hold me to an exact number, where the kindergartners that went into school this year for the first time, the rates of anti-vaxxers or kids who have 0 vaccines on board exceeds 5% now. Yes. In at least 8 states, maybe 18. I know Broward County in Florida, you and I both have places in Florida. They announced their highest rate of unvaccinated children entering kindergarten in the history of keeping records. And while people say, well, 5%, what's 5%? Well, you've got 5% of all of these petri dishes of infection sitting in a school unvaccinated against measles, unvaccinated against mumps and rubella. And all it's going to take is 1 case of measles in that community, like we've seen in a place in Ohio where someone came into an unvaccinated community and brought in measles. And significant numbers of people were affected. So it's really scary to us, the number that are just completely unvaccinated. That pendulum has swung so much from people begging for vaccines to now we're going to opt out. It also should be known, though, that this is not a new concept. I actually found a poster from 1918 where they had hung in towns, meeting tonight to discuss no vaccines. Now, for our listeners, and no masking.
So with influenza, yes.
It wasn't vaccines, I apologize. It was anti-masking in 1918 with the Spanish flu going around, and they vaccines. So this protesting masks, darn, I keep saying that. So, this is not a new concept. Everyone has an opinion, right? But now I think with social media and people being able to, you have this algorithm that when you look up something on your Google, for instance, it translates to other platforms. And so just try shopping for a pair of shoes today on your browser and then go on to social media and you will see. In fact, I'm sure my phone is sitting here. I'm sure when I get on social media, there'll be something from one of my favorite shoe stores advertising some nice shoes. And this is what happens is that algorithm is set that if you search for something or you post on an anti-vax claim, you're then going to be fed everything in that algorithm, which makes people believe it. And it makes people believe that that's the reality, not the abnormality.
Right. No, I totally agree. And one thing, I started in pediatric and neonatal practice, and I practiced for a long time as a nurse. And I remember I had a patient die from Haemophilus influenza before we gave the vaccine, and it was quick, high fever, brain herniation. And then later on in practice, I had a little girl in the pediatric ICU who died of pertussis, who was not vaccinated. She was like 2.
Right? If you've seen it, like I have imprinted in my brain bacterial meningitis at Children's Hospital in Boston. What I think people don't realize as we talk about these adverse events, since the introduction of the pneumococcal vaccines, what was it, 15 years ago? We started with PCV7. Now we're at PCV 20. And soon to be 21 and soon to be 27. 2 things, 70% decline in invasive pneumococcal disease in babies as a result of that 15 years ago. 70% reduction in pertussis cases in newborns because we're giving mom the Tdap in pregnancy. We have made such huge strides. And what I don't want to see us do is backslide because people are into these conspiracy theories. And I tell patients I'm not into conspiracy theories, and I would really appreciate it if we don't have that conversation because I just don't live in that world. We've got way bigger things we have to discuss today other than conspiracy theories. And we've done such good with these vaccines. I hate to see us lose it. And you and I have lived in a time where bacterial meningitis was fairly common. You probably have heard CDC's meeting in October to discuss eliminating the 11 to 12-year-old MCV vaccine. We're expecting to hear about that soon because of the decline in meningitis cases. And my gut is they've gone down because we're vaccinating. So stay tuned. Lots is happening in this front.
That's actually good news. It's just like taking the smallpox vaccine away, right? That was a big deal, and it's because we made strides and vaccinated, eliminated disease. As nurses, we're the most trusted healthcare profession of all, and populace-wise, nurses and nurse practitioners represent a big portion of healthcare. Do you think that we still have the power to influence vaccines, or did COVID change things in that arena? Is it possible that patients will trust us?
I really believe they trust us. I really believe it. Every day in my clinic, people say to me, I trust you. I trust you with my life. If you tell me that this is what I need to do, I'm going to do it. And I say to them, and I'm grateful for that trust. And please know that I don't take that trust lightly. that whatever I recommend for you is something I would recommend for my son and for my husband and for me. And so I do believe that they trust us. And so we have to use our position as that person of trust to deliver factual, evidence-based recommendations. I don't drink the water. I do my research, and I make sure that what I'm recommending to them is not just what the CDC tells me to do, but that I have chosen the right vaccine for the right patient. And I'm looking at all of those factors, and I make decisions on which brand I go with based upon the research that I've done, because I have the ability to do that. And so I do believe that they trust us, Terri, and if they don't, maybe they move on from me, which is fine as well, because it has to be a partnership. It's not do as I say. It's I'm making a recommendation to you. It's your job to figure out if that's something you're going to do or not.
Yeah, I know. I think that's a really good approach. If it's not anything you wouldn't do yourself, and just building that rapport and using a little motivational interviewing or compromising on some level, I think goes a long way with patients.
I agree. You know what? I am not into this is you have to do this. I know that there are some practices out there in the pediatric world that if you're not vaccinating your kids, I know a friend of mine has a practice, and if you haven't vaccinated your children by 9 months of age, you must find yourself another practice to take your child to. I don't operate under that do as I say, and if you don't, you're out. I feel like if they have to interact with me and my team, who at every visit looks at vaccines and makes recommendations, we don't care what you're here for. We're going to look at your vaccines while you're here. I feel like if anyone's going to move the trajectory and if anyone's going to move the pendulum, it'll be us by being vigilant and being consistent and working with where people are at.
Yeah, I totally agree. And just always conveying to them that they deserve the best healthcare advice and that their outcomes that's our interest, right? That's why we're doing what we're doing. Right. Yeah.
Exactly.
So vaccines work.
They do work.
For patients who do not have primary care providers, and maybe we're interacting with them on other ways, urgent care, telehealth, how do we get them vaccinated?
Yeah. So a couple of things is when we look at what happened during the COVID pandemic, our pharmacists were really the leader in vaccinating. And of all the other professions, I think pharmacists have historically also been one of the top and most trusted. So working with pharmacies, a lot of the Department of Public Health don't always have convenient hours. They're not always convenient, but there's a pharmacy in every community pretty much, if not more than one. So getting people to have a relationship with a pharmacy, the pharmacy is often restricted as to the ages that they can vaccinate. Many states don't allow them to do children under 2. And so some of the pediatric vaccines have to be administered in places like primary care, pediatric offices, family practice. And if they don't have one, or if they're not providers taking on new patients, this is a real concern. We saw almost 400,000 providers walk out of the profession during the COVID pandemic, and it's left a huge hole, particularly in primary care, which is a really hard specialty to be in. It's busy and it's hard, and I love it and I will never leave it. And when I think I'm out completely, because I am so wedded to primary care and that relationship that I develop with people. But at the end of the day, I will tell you, it is often the dumping ground of a lot of other specialties, and primary care is really being yanked at the margins, and it's difficult. It's really difficult to get people into a primary care office to get vaccinated because there just aren't enough of us.
Yeah, I think this is where using your LPNs and your registered nurses in an office for vaccination and vaccine appointments can be really helpful in primary care as well.
Absolutely. CDC says they don't need an evaluation by you and I, that people who are either delegated or people who have the authority, i.e. RNs and LPNs, to make those decisions. In our state, medical assistants are allowed to administer, but only under the delegate, only under as a task. They can't decide what people need, but they can administer the vaccine as a task. So what we do in our clinic is the nurse practitioner pulls the vaccines that she wants the MA to administer. The MA double checks the schedule to make sure that we do a 4-eye inspection of a vaccine to make sure we're not making a mistake. And then the MAs in our clinic do most of them, but there's no reason RNs, LPNs can't run clinics either. I think it takes a village, Terri, and it can't just be primary and it can't just be pharmacy. It has to be specialty. It has to be hospitals. It has to be all of us working together to get people vaccinated, particularly now that COVID is not provided by the government, the vaccine. It has to be billed out, and it is not an inexpensive vaccine. So making sure that we're all working as a team and communicating.
I think that's a really good point. And so many of the health departments give vaccines, but there's been funding cuts in many states across the board. And I speak from personal experience. I carry my own insurance policy with a large carrier who I will not name, but I pay lots of money every month and there is no vaccination. There's no preventative coverage on this. So I have to pay out of pocket to get vaccines.
To me, because under the Affordable Care Act, that was all supposed to be eliminated. That preventive care, well visits, all vaccinations are supposed to be covered. And in the world of adults, in January of 2023, it was mandated that and it's legislation, that all Medicare Part D plans must cover the CDC's recommended ACIP recommendations vaccinations at no cost to the insured. And so vaccines like, the shingles vaccine, vaccines like the twin Ricks, Hep A, Hep B together, the Tdap, the RSV vaccines are all under Part D. And so it is mandated that they have no patient responsibility.
That's a good way to get it done, because it saves us money on the other end, right?
Dollar you spend on vaccines saves between $11 and $42 in disease-related costs. Most cost-effective prevention strategy in the world.
Yes. Yep. I'm all for them. Okay, you and I should talk about primary care someday on the podcast. And
happy to.
Okay, we'll do that in the future. Any parting words of advice for us on vaccinations and dispelling vaccine myths as primary care providers?
If I can just give you a few bits of, let's pull this together. What I want you to walk away from today is, one, your language matters. Don't ask Johnny if he wants to get a vaccine. Tell Johnny's mom that he's due for a vaccine today. You've got it in the clinic. Let's get it on board. That's called presumptive language. It works much better than saying, "So how do you feel, Johnny, about getting a shot today?" Of course, none of us want shots. Participatory doesn't work. Presumptive does. Number two, you are the most trusted provider. 90% of patients cite their PCP, their primary care provider, as their leading source of vaccine information. Use your position. You can change the trajectory. Don't lose your life fighting with someone who is 100% anti-vax. You know what? Set the stage and move on. Work on the movable middle, because you will change that pendulum and you will move it. And the only religious group who says vaccines are generally not recommended are folks of Christian Science religion.
Okay.
Catholic, Judaism, all recommend vaccines. Even if there's pork in them, they're recommended. Even if they're made from stem cell lines or aborted fetal lines, the Catholic diocese says these vaccines are important. And so when people ask about religious exemptions, I ask them what religion they are. I'm not going to sign anything unless it's Christian Science, because that is truly the only religion that it does not recommend vaccinations. The rest all recommend that people are vaccinated to live healthier lives. I think those are remarks.
No, that was perfect. I meant to ask you about religious exemptions and what you do on that. Thank you for bringing that up. Um, no, I appreciate you being here with us and talking about this. I think it's a subject that we need to continue discussing as the world changes and as recommendations change. You're going to be with us in Dana Point in just a couple of weeks.
And we're going to do PD vaccines, and then we're going to another session on adult vaccinations as well. So I look forward to being, first of all, in Dana Point. So if our listeners have never been to Dana Point, oh my, you all need to get on a plane and join us out here, because it's a beautiful hotel, beautiful venue, and great speakers. And so come on out and have some fun with us.
It is beautiful. And we looked at flights just this last week, and they're still like under $300 round trip out of Boston and the Northeast to get to Dana Point that week. So I don't know.
Very cool. Very cool. You will not be sad. Trust me when I tell you, it's an amazing venue. So thank you for having me. I appreciate this time here today, and I can't wait to see you all in Dana Point as well.
Dr. Wright, thank you so much for being here with us. We will have you on again. For everyone listening, be sure to check out npace.org for information on all things NPACE. You can find the Dana Point information there and our 2025 conferences, and at our Learning Center at learn.npace.org if you want to learn virtually. We are an ANCC accredited provider for continuing education. Again, we're very, very thankful to Merck for allowing us to offer CE with this program. And you can find this podcast on Spotify, on Apple. We'll load it on our YouTube page, but you have to go to learn.npace.org to get your credit. Thank you so much for tuning in. This concludes our Friends of NPACE podcast. Keep an eye on our website and social media channels for any more information. And again, Dr. Wright, thank you for being with us.
Thank you. Till I see you all later.